It is now September, so you may want to start searching for where and when to get an updated COVID vaccine.
The FDA just approved the new formula mid last week, with both Pfizer and Moderna saying they'll be shipping vaccines soon. But actually getting that shot will definitely be harder than it's ever been.
Joining us now to talk about all of this is Upstate Global Health Director, Dr. Stephen Thomas. Thank you for joining us tonight.
Yeah, thanks for having me.
All right, first let's get started with COVID cases. How are we doing in this region? What are the numbers looking like?
Yeah, we're actually doing okay. So the number of people who are presenting to the physician to get tested, that number is going up, and the number of positive tests is going up. But the number of people that are in the hospital and the number of people that are experiencing severe disease is held steady at a very low number. So we definitely have virus circulating in the community, but overall we're doing well right now.
Give us a little insight on this new vaccine, the formula. What's it targeting here? I know we've talked about this a little bit. Refresh us.
Right, yeah. So, you know, the predominant variant that is circulating globally and certainly within the United States and this region, it's part of a family of, still is Omicron. We remember that name, still Omicron, still part of this JN1 family, and the new formulation that has been released is targeting that and targeting a cousin of that. So we should be pretty good with the match between the virus and the vaccine formulation.
All right, let's talk availability now. Who is eligible per the new FDA guidelines?
Yeah, so it's very confusing. I'll just put it out there immediately. So anybody who's over 65 years of age will have access to the vaccine. If you're 64 and under, down to 6 months or so, then you have to have a pre-existing medical condition that puts you at risk for severe disease. Those conditions, there's a bunch of them, almost 24 of them that you can find on the CDC website. It's everything from diabetes to current or former smoker, physical inactivity, obesity, heart disease. It's a very, very long list, and you can find it on the CDC website. What is not in the new recommendations, pregnant women. The FDA did not recommend the vaccine for pregnant women, which a lot of OBGYNs are up in arms about, and rightly so. And then kids under 2 years of age who experience severe disease disproportionately was also not on the list, and so that's a little bit of a gray area of how those populations would get vaccinated.
So the White House says, quote, and I want to make sure I get this right, 100% of adults in this country can still get the vaccine if they choose. We are not limiting availability to anyone, close quote. But based on the guidelines you just gave us there, it seems like it's at least not as easy, or may not be covered by insurance, which seems like limiting accessibility. Right. Am I understanding this wrong?
Yeah, I mean, there's a lot in that quote that could be unpacked, but we can just kind of focus on the big picture, which is if you're adults, so if you're between 18 and 64 and you do not have a pre-existing medical condition that's on that list, then you may need a prescription from a healthcare provider. Okay, that's and that could be difficult to get. The confusion that is occurring, you know, 90% of COVID vaccines are given at pharmacies, right? And the pharmacies are now confused about what to do, and some pharmacies have just said, we're pausing until we get more information. Others have started putting procedures in place that may make it difficult. And then the third thing is that who's going to pay for it? So it may be, you know, the third-party payers, insurance companies, may say, well, geez, if the recommendation isn't there from the federal government, then maybe we don't have to pay for this. So there's more than one way to decrease access and accessibility to vaccines. So I would take a little bit of an issue with the quote.
Well, we got to ask you, as an infectious diseases expert, what is your educated opinion about these new FDA rules?
Well, I'll put it this way. I would probably have a different opinion on who should be vaccinated, or at least who should be given the opportunity to make that choice. I certainly think, I'm not a pediatrician, but I certainly think the data is pretty convincing that kids under 2 years of age, their parents should consider it and talk to their healthcare provider about it, their pediatrician about it. I think pregnant women should talk to their OBs about it, because pregnant women who get COVID are at increased risk for a bad outcome, both the mom and the unborn child. And then people who may not have any pre-existing medical conditions, but they live with somebody who does and who is at risk, or maybe there's somebody who is in a first responder, who's in law enforcement, who works in a hospital and are at around, maybe they take care of somebody who's elderly or an older adult. They may not be at increased risk, but they may interface with people who are at increased risk, and they want to get vaccinated, not necessarily for themselves, but for the benefit that it can be for other people. So that's who I would recommend. Think about it and talk to their provider and make a decision.
You mentioned earlier about possibly getting a prescription from your doctor. Does that now put doctors in some sort of risk, or yeah, what does that mean? If it's not recommended, can a doctor just simply say, I write this kind of, what do they call, off-label or something?
Right.
They do it.
Off-label. It's done all the time. It's done for medications. It's done for vaccinations at times. So it's not a foreign concept, but it does introduce this idea of risk or liability for the healthcare provider. And you know, with the way things are these days, that could be there could be a sense of a heightened risk of what do they do, you know, what's going to happen to them if they're prescribing things off-label. I think, you know, the vast majority of people in the country believe in germ theory. They believe that bugs make us sick, and they believe that vaccines can help reduce the risk. And people in the medical and science fields believe that as well, the overwhelming majority. So I think you can have a rational conversation with your healthcare provider, and you can get a prescription if together you make the decision that it's in your best interest to do so.
So that's your best recommendation if there's somebody who wants to get a COVID shot, does not meet the required recommendations.
Have a conversation with your healthcare provider. Explain the rationale for why you're considering it. Go over the risks and benefits for you as an individual or your family member, and make a decision, which is, by the way, it's, you know, this shared medical decision making. It's how we practice medicine. It's how it's always been. And so, but it's I will say, with confusing recommendations and confusing guidance coming from the federal government, the onus is even more now on the individual and that patient-physician relationship to make these decisions.
About 15, 20 seconds. Maybe a little bit more clarity come mid-September when the CDC's advisory panel meets. We might get a little bit more clarity on all of this, possibly? A little?
I would say that's very optimistic on your part. I'm not sure that that's actually going to happen because the constitution of that committee has changed so substantially. I'm not sure who's going to be in that full committee and what their education, training, and experiences as it relates to vaccines and vaccine safety and assessing risk-benefit.
All right, another great conversation and great recommendations, and we appreciate your time and your expertise.
Thanks for having me.
Thomas, thank you.
Appreciate it.